Development of heart. Two heart tubes fuse in the middle. One heart tube with lower venous end, sinus venosus, and upper arterial end, truncus arteriosus. Lower venous end, sinus venosus. Upper arterial end, truncus arteriosus. Sinus venosus. It has right and left horn. The right and left horn receive blood from three fetal veins on either side: common cardinal vein, umbilical vein, vital line vein. Movement of blood from right and left horn of sinus venosus, right and left horn of sinus venosus, then into sinus venosus, then into primitive atrium, then to primitive ventricle, then to bulbus cordis, then to truncus arteriosus. After this, cardiac looping occurs. This means atria move more superiorly, ventricles move more inferiorly, upper arteries move anteriorly, lower veins move posteriorly. Septa formation also starts. Folding of heart tube. Upper arterial end comes anteriorly, lower venous end goes posteriorly. Transverse pericardial sinus. It is the space between anterior artery and posterior vein. Anterior arterial end forms ascending aorta, pulmonary trunk. Posterior venous end forms SVC, IVC. Anterior arterial end forms ascending aorta, pulmonary trunk. Posterior venous end forms SVC, IVC. Due to this cardiac looping, atria come superiorly and posteriorly. Ventricles come inferiorly and anteriorly. Atria come superiorly and posteriorly. Ventricles come inferiorly and anteriorly. A finger can slide between transverse pericardial sinus, which helps in differentiating the arteries and veins. Ascending aorta and pulmonary trunk can be pulled forward using finger. SVC can be seen behind the finger. Posterior view of developing heart. Left horn of sinus venosus. It is relatively small. It contributes to form coronary sinus of heart. It receives venous blood from heart and drains it into posterior wall of right atrium. Right horn of sinus venosus. It is relatively large. It is absorbed into posterior wall of primitive atrium. It contributes to form sinus venarium, which is superior smooth posterior wall of right atrium. Left horn of sinus venosus, right horn of sinus venosus. Left horn is relatively small. It contributes to form coronary sinus of heart. It receives venous blood from heart and drains it into posterior wall of right atrium. Right heart of sinus venosus, right horn of sinus venosus. It is relatively large. It is absorbed into posterior wall of primitive atrium. It contributes to form sinus venarium, which is smooth posterior wall of right atrium. Primitive atrium contributes to form rough anterior wall of right atrium. Left cardinal veins regresses. Right anterior cardinal vein contributes to form SVC. Right posterior cardinal vein contributes to form IVC. Right anterior cardinal vein contributes to form SVC. Right posterior cardinal vein contributes to form IVC. Three openings in the posterior wall of right atrium: coronary sinus, superior vena cava, inferior vena cava. Four pulmonary veins open into posterior wall of right atrium. Sulcus terminalis. It is the boundary between smooth posterior wall of right atrium and rough anterior wall of right atrium. It is seen from outside. Crista terminalis. It corresponds to sulcus terminalis but on inside of atrium. Sulcus terminalis. It is the boundary between smooth posterior wall of right atrium and rough anterior wall of right atrium. It is seen from outside. Crista terminalis. It corresponds to sulcus terminalis but inside of atrium. Right horn of sinus venosus, left horn of sinus venosus, primitive atrium, right anterior cardinal vein, right posterior cardinal vein. Three openings in the posterior wall of right atrium. Coronary sinus, superior vena cava, inferior vena cava. Four pulmonary veins opens into posterior wall of right atrium. Sulcus terminalis, crista terminalis. Sulcus terminalis is boundary between smooth posterior wall of right atrium and rough anterior wall of right atrium.